Hi friends, welcome to I Love Pharmacology. Today you will going to learn about Reye syndrome. So coming to the Reye syndrome mainly occurs in children's, which will be characterized by encephalitis combined with a liver failure. So Reye syndrome is more often seen in children's, which is characterized by encephalitis combined with liver failure. So it affects both liver as well as the brain. So most commonly it occurs due to the viral infection, mainly during the recovery phase of viral infection. So here the main treatment involves controlling cerebral edema and correcting the metabolic abnormalities. So by controlling the cerebral edema, you will be preventing the brain damage as far as possible. But in case of Reye syndrome, the significant mortality is mainly due to the brain damage. Because of the brain damage, the mortality rate increases. So the specific cause to this is still unknown, and the probable cause to the development of Reye syndrome suspected is use of aspirin in children during the recovery phase of the viral infection. So that's why aspirin, you should keep in mind, you should avoid giving aspirin in children younger than 12 years of age unless it is specifically indicated. So here you can see the cerebral edema. So remember, aspirin should be avoided in age below 12 years. So next, coming to the arachidonic acid pathway. So from the membrane phospholipid with the help of the phospholipase A2 is responsible for the activation of membrane phospholipid, which leads to the synthesis of arachidonic acid. From the arachidonic acid there are two pathways. One is the responsible for development of the prostaglandins with the help of cyclooxygenase. Other pathway is lipoxygenase pathway, which is responsible for the synthesis of leukotriene. So whenever you give a aspirin, what happens? It will inhibit the cyclooxygenase. There will be irreversible inhibition of the cyclooxygenase. Thereby it prevents the formation of the prostaglandin, which is the one of the inflammatory mediators. So what happens when these pathway has been inhibited? The other pathway, that is lipoxygenase pathway, takes the upper hand. So thereby it increases the activity of lipoxygenase. So whatever the arachidonic acid pathway is there, it will be directed into the lipoxygenase pathway. So thereby there will be increase in the leukotriene production. So what happens when there is an increase in leukotriene production? Again, it is also an inflammatory mediator which can cause anaphylactic reactions. So it can cause anaphylactoid like reactions. It can cause bronchospasm, it can cause allergic reaction, and it can cause even the death. So you should be very careful. So that's why in case of bronchial asthma, patient, you should avoid giving aspirin because aspirin will divert the arachidonic acid pathway into the lipoxygenase pathway, where there will be increase in the leukotriene production and it causes bronchoconstriction in case of bronchial asthma individuals. So, in case of Reye syndrome, coming to the summary, it is probably caused due to the aspirin, especially when given to the children of age group below 12 years who is recovering from the viral infection. So in such case, the children's will be associated with encephalitis as well as liver failure, which will lead to the cerebral edema, metabolic abnormalities, finally leading to the brain damage. So thank you. For more updates, like and subscribe to I Love Pharmacology, and do not forget to share and press the bell icon.